All right, so we are recording. As I mentioned, this is a Q&A with me in regards to vitamin C due to the promotion that we have running right now, the Go and Glow bundle. I had Marilyn put all the questions. So we've been getting questions from our patients, from people on our email list, and also on social media. I said, you know what, before I end my work day today, let me do a Q&A. I'm recording this on video for YouTube, but I'm also streaming on Instagram and Facebook Live. So if you want to see the videos with the questions on the screen, because I'm screen sharing all the questions, I wrote a few of the answers, but I might expand a little, expand on the answers as well. But I wanted to just, if you're looking at this and you're reading this, you can have the basis of the answers, the general answers. Again, we have a promotion running right now. The last day to get the promotion is May 12. It is a combination of high-dose vitamin C infusion plus the natural weight loss slash energy boosting injections, which is Make B12. I've done so many videos on Make B12 because it is a new service that we introduced. It's no longer new. It's been a month now. But I have to tell you, our patients are loving this injection. Only because after the second injection, they were able to see the difference. And the first reported improvement is energy. Before I go into the Q&A, let me tell you something. You cannot function without energy. Energy is required for you to heal your body. You need energy, your cells need energy. And guess what? As we are getting sick, things are happening at the cellular level. Energy happens to be the first thing we lose, right? For instance, if you're fighting a cold, right? You have the flu. You have COVID, you have a virus, right? You have an infection. You're gonna feel sluggish, you're gonna feel tired. And what is that? Low energy. And I understand you can be like, you can say, well, Dr. Genty, I'm just gonna drink coffee, I'm gonna pop some energy drink, stimulant. But again, these things are toxic to your body. A lot of the coffee that we drink is moldy. Okay, so we don't want to depend on an external product or source for us to have energy to function our day-to-day, life. So if you're interested, like, okay, I can use some energy because I need energy to function in my life. I need energy to be present for my family. I need energy to play with my kids. I'm tired of being tired and have been experiencing chronic fatigue, or you have an autoimmune condition, your energy is low. You have fibromyalgia, your energy is low. You're fighting an infection, even the allergies now, right? It's allergy season here. People are suffering with the allergens. You need energy. There's not that much you can do with that energy. You cannot make a big impact in this world. You cannot fulfill your purpose without having energy. Okay, so the natural Make B12, the team just recorded a video which we posted on YouTube explaining how every single ingredient in that combination, the Make B12 syringe or the Make B12 injection, works together to produce energy, to help with appetite control, to help with weight loss, for cognitive function, helps with cholesterol, helps with the cardiovascular. Like it's powerful. It is really powerful. But today, as I mentioned, people can understand the B12 because we all know B12 is great. And maybe they research the MIC, which is methionine, inositol, choline, right? And then we have L-carnitine and B1 because we're always changing the ingredients. So we literally formulate our own injections with it. We give you what you need so you can you can feel and see the improvement. So therefore, we can tweak, remove, and add increased dosage so that you can feel it. The thing is, you have to feel it. Do not go out there, spend your money, working with doctors, working with practitioners, working with people, and you don't know what to feel, and you're not sure if you're gonna see improvement. So we always work with our patients, and we're always tweaking and customizing, making sure the products we are delivering to our patients um, is conducive and is also effective so they can feel it. Okay? So again, the Go and Glow bundle ends May 12th, 13th, that Monday. Lord, May it is. Wait, May 12th. Okay, so if you're interested, you can get the bundle for The prices, call us because I don't know the prices, but I know it's a massive discount because the vitamin C infusion is $294 plus the the natural injection, the natural energy and weight loss injection is 65, but you can get the combination, the bundle for 300 something dollars. So don't quote me. Even if you are watching this or you seeing this video or this post after the promotion is over, please do not wait. You still can call us and you still can come in and get it. Okay? So now let's do our Q&A. All right. If you are and you've been in my world, you know that I love vitamin C infusion. Love vitamin C infusion. I was talking to a patient the other day. I'm like, if I am on a deserted island and you're like, Dr. Genty, what should I have? Give me a vitamin C. Give me a vitamin C bag and I'll be happy. Vitamin C happens to be the most underrated, underutilized treatment that a lot of people are not considering. But it so happens to be the oldest treatment that my ancestors used, my grandma used to use back home. I'm from Haiti, when we are fighting a cold, a virus, allergy, inflammation, and a weak immune system. And it so happens to be the number one natural treatment for cancer. Cancer and also autoimmune condition. Now, what is the difference between vitamin C by mouth and the infusion, right? So when I say infusion, I'm talking about like a needle goes into your vein or catheter goes into a vein, and then we are infusing the content of the bag straight to your cells, bypassing your gut. IV vitamin therapy happens to be the secret sauce in my clinic for my patients. I have like over 100 reviews, over. And I have to tell you, I can see the difference between the people that are doing IV vitamin therapy versus those that are not. They still feel the improvement, but they are struggling. The ones that are not doing IVs, the progress, the healing is longer for them. So as I opened my clinic here, right, one of Scona and J, I started helping a lot of cancer patients because I am a certified integrative oncologist here in the state of New Jersey. So, and I did a whole cancer thing. I opened my clinic, and I have to tell you, I am able to literally see my cancer patients from struggling to thriving. Now, I'm not saying all we did is just high dose vitamin C, that's it. No, 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 no. But every single one who receive vitamin C is able to handle any treatment they are doing, as well as if they work with me and they hire me and we do concussion, like I have an herbalist. I used to use an herbalist in California to formulate herbs specifically for the cancers that I was treating. Now, that's cancer. But when it comes to autoimmune, like you don't have to have cancer to utilize IV vitamin C infusion. I don't have cancer. I do my IV drip and I'm on a maintenance now, and I do IV vitamin therapy, I vitamin C every month. When I am traveling, I boost up because I don't know what I'm picking up at the airport or at the hotel I'm going to, and I do not have time to be sick. I'm sorry. I don't get sick. So knowing that we have so many things out there, unfortunately for us, we don't see those viruses floating around or the allergens or the toxins that can activate our immune system. We don't see them. So what we need to do, we need to be proactive and prevent. I practice preventative medicine. So I'm just going to infuse my body, give my cells, my soldiers, which is the immune system, what they need so that when they have to go out and protect me and fight for me, they are strong and they have been taken care of. Okay? If you don't do anything, if you are considering IV vitamin therapy, and you do not do anything, I would love for you to consider high dose vitamin C. What is a high dose vitamin C? For us in our clinic, everything has to be preservative free. It is very important that you ask questions, right? If you're not in New Jersey and you live far and you are using this video to educate yourself, ask. Preservative free is going to say preservative free on the bottle, right? When the practitioner is using it. And a high dose is anywhere from 50 grams to 100 grams, which is 100 ml to 200 ml. And Some might consider high-dose vitamin C at 30 ml. Like I will start my patients, the ones that are brand new to vitamin C at 30, because I'm always thinking about safety first. But and then we work them up um to 50 ml and then 100 ml. So that's the goal. But high dose means more than 20 ml, more than 10 ml. A lot of places out there are promoting high dose vitamin C, but when you ask them what is the dosage, they say 15. That's not high dose vitamin C. In that bag, you also have to have three other ingredients, okay? Because vitamin C is such a powerful, safe, effective vitamin. It's a multitasker. And as I answer the questions, you're going to see why it is a multitasker. Okay, you have to have magnesium, potassium, and calcium in the bag. Because if you don't, as that vitamin C is going into your cells, into your tissues, into your organ, doing the work that you ask it to do or what it is designed to do, is going to pull out those electrolytes and you're going to feel symptoms. You're going to feel discomfort, and we don't want that. So if you work with a practitioner like myself, I have been doing IV vitamin therapy since 2010. Yep, 2010. 2010. And to be honest with you, it is one of the service that I will always have in my world. People underestimate the power of IV vitamin therapy for a few reasons, because it's not covered by insurance, so I'm not gonna do it. And because it's not being promoted on mainstream media, but people are not talking about it, so I'm not gonna do it. And oh, because the doctors are telling them don't do it, it's dangerous, so I'm not gonna do it. When in fact that is not true. It's vitamin C, it's a vitamin. How can a vitamin be dangerous for you? So it's okay for you to take like a zillion pills, to take ecstasy, to take all these vitamin powders out there in the market when where you're not absorbing it, because many of you guys are not absorbing. You have digestive issues, right? You have gut issues. You're not absorbing the vitamin. It's okay for you to do this, right? But when it comes to you investing in an infusion where you're actually gonna receive 100% and the absorption rate is way higher, 100%, we don't want to do it. You know how many times patients will come to me, I would talk to them, I would, to educate them vitamin C and how safe it is. And there are so many literature and research studies out there. And then they'll go back to the doctors, they'll go back to the oncologist. They say, oh no, my doctor said it's dangerous. But yet, the medications are not dangerous. The cancer treatments are not dangerous. The radiation is not dangerous, but the vitamins that can actually revive your cells, help them fight for you, that's dangerous. Do you see how this world is messed up? I'm just saying. But for me and my patients, the ones that are coming to me after seeing so many doctors, okay, I'm not new at this. I've been doing this for 11 years. 11 years. I've been practicing in the medical world for 16, but functional medicine for 11 years. So my license is important to me. I usually tell patients, like, I'm going to recommend something that, something is going to happen to you, you're going to end up in a hospital, and then I have to lose my license? No way. So I'm always thinking about how I can keep people safe before I make my recommendations. Because people can sue you, and I have my practice insurance is high. I don't want any issues. We don't want any emergencies here. So I'm going to go to the questions. I would love for you to listen to the answers. Again, I'm going to expand on them. And I would love for you to consider getting high-dose vitamin C for the conditions that you're faced with. If you're saying, well, Dr. Genty, I'm 100% healthy, like me, there's no such things, then think about maintenance. Do you want to wait until you get sick to improve your health? Or do you want to work on it now so you can prevent sickness? For me, it's always preventative care, proactive. We do not practice reactive medicine in my world. Never. Never, 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 never. And there's always room for improvement. We always have something we can work on because we all exposed. Okay? I don't live in a bubble. You don't live in a bubble. Even if you feel amazing. Is there something you can do to continue feeling amazing? That's my goal. All right. So first question, what is vitamin C infusion? Vitamin C infusion, again, is an intravenous process where we formulate a bag. In my practice, it's all preservative-free. We use high-dose vitamin C. We connect it into your bloodstream. We infuse it directly to your bloodstream. You go straight to your cells, bypassing your GI tract. We do not want to ingest a lot of vitamins to your gut, okay? You're not absorbing it. You're not absorbing it. And a lot of people, oh my God, what is this? A lot of people will have stomach issues. You're gonna have bowel intolerance. We don't do vitamin C to the gut. If you take vitamins by mouth, you're only getting 10 to 15%. Okay, that's why many of those vitamins out there, the recommendations for you to take 6 pills. That's a lot of pills. I don't know about you. I'm a very busy professional. I have a clinic that I'm running. I have family. I have a lot of things going on. So I'm gonna go and spend like an hour or two, get my vitamins, and I'm done for the week. So IV vitamin therapy is for serious people, people that are looking for health and longevity, people that invest in themselves, people that loves feeling amazing, people that are focusing on making an impact in the world. So if you want to make an impact in the world, you don't want to be sick. You don't have time to be sick. Okay? And it's for the biohackers, the celebrities. Okay, but it doesn't have to be that way. We can make it a norm, right? Like a lot of people will look at me, well, Oprah does IV vitamin therapy. She has money. Or Rihanna does IV vitamin therapy. She has money. But guess what? Because they're doing it, so therefore they are addressing the internal issues right, at the cellular level so they can go out there and make more money. I do IV vitamin therapy because I want to make more money. Okay, I want to be out there and serve people in exchange. But if I'm here and I'm sluggish and I'm tired, I always have a cold, a flu. I'm like this. I'm like, oh my God, another. I pick up every little germs for my kids. How am I making an impact in the world? I'm not. So IV vitamin therapy is for serious people, period. So, question number 2, what are the benefits of vitamin C infusion? Oh, Lord. The laundry list. The list is long. First, let's talk about immune function. Our immune system is being activated every single minute. By what? Toxins from your food, herbicides, pesticides, right? The air that we breathe all of the time. So, IV vitamin C strengthen your immune system, the immune cells. I call them the soldiers, the army in our bodies. They are the cells, the immune cells. They go out and fight for us and protect us. Think about America, right? We have the army, we have the navy, we have all these people, and then terrorists are coming. I'm not gonna go fight. They're gonna go fight. So, but if they don't have what they need to be strong, how are they gonna fight for us? Right? If they're not being taken care of, we're not feeding them, we're not training them, we're not giving them hydration, we're not like the environment is not conducive, they start dying, they are weak, they're not gonna fight for us. So that's the same thing with your immune cells. If you look at your health and you say, okay, I'm always getting sick, get you some high dose vitamin C infusion. It reduces inflammation. Okay, boosts collagen production, enhances energy. Yes, my cancer patients, my autoimmune patients, my post-viral patients, they feel the energy. How is that? Because it's literally removing, decreasing, so therefore your cells have more time to produce mitochondria. They have time to produce ATP. They have time to produce for you, so you're gonna have more energy. Helps with detoxification. High dose vitamin C infusion detoxifies. That's why in the bag that we make for patients, we have to put potassium, magnesium, and calcium. A lot of people that are toxic, they'll come to me and I will give them high dose vitamin C. They're like, oh my God, I'm feeling this. I'm like, yeah, your toxins are leaving your body, right? They were dormant. It's like the Waking Dead, the Walking Dead is at the show. They were dormant, and then you poke them with the vitamin C. They're like, oh, they're all wide awake. And now you start feeling it, which is good. We want to feel the detoxification. We don't want to end up in the hospital. We want to feel something is working. Helps with antioxidant stress. IV vitamin therapy is good for all illnesses and diseases. As I mentioned, I do it because I'm maintaining. I don't do vitamin C because I'm sick. I don't want to get sick. I want to be strong all of the time. That's my priority. My health is my priority. Me feeling amazing every day is my priority. So I do high dose vitamin C every month. If I'm traveling, 2 weeks leading up to my travels, because I'm going to hug people, I'm going to talk people, and we don't know what people have. So it is your responsibility to work on you and mind your business, right? Stay on your lane. I'm not worrying about what whoever has over there. I'm worrying about me. So how is IV vitamin therapy different from oral vitamin C? Again, those are questions that came in because of the promotion we have running right now. So I'm looking at the screen. I have it all written down. I'm going to post this video on YouTube if you want to see the questions and the answers. You can go to our YouTube channel and see that. But the question is, how is vitamin C different from oral vitamin C? Again, IV vitamin C, you get 100%. You bypassing the GI tract. A lot of people have gut issues, bloating, gas, constipation, diarrhea, stomach cramping, right? Like acid reflux, malabsorption, malnutrition, poor metabolism. Your gut is not functioning properly for you. So when you take vitamin C by mouth, which people want to do because it's less cost effective, right? It's cheaper. Let me go get some ecstasy. Let me just put all this vitamin C. You're not absorbing. You're not absorbing. So vitamin C allows much higher concentration in your bloodstream, straight to your cells, and it's leaving your intestinal lining alone. Okay, so you're not really having things sitting in your gut that you're not absorbing and collecting dust. And next thing you know, you're not really seeing the full effect and the improvement of the vitamin C. What conditions may benefit from vitamin C infusion? Every condition, every. I use vitamin C again to maintain. I use vitamin C for chronic fatigue, all autoimmune conditions, despite what your endocrinologists or your autoimmune doctors are saying. It's vitamin C. Like this is old. We have to dismantle old belief. It is not gonna hurt you. Again, in my 11 years of owning this clinic, helping cancer patients, whether they are receiving chemotherapy or not, I've never endangered anybody with vitamin C. It's good for viral infections, cold, flu, COVID, herpes, Epstein-Barr virus, right? Like all the Coxsackie virus, cytomegalovirus, parvovirus, like you name it. Shingles is good for viral infections. Lyme's disease, you need IV vitamin therapy if you have Lyme's disease. I live in New Jersey. Lyme is so prominent in my state, and people are not even aware that doxycycline that I used to prescribe doesn't treat Lyme. What, Dr. Gentil? Yeah, it doesn't. I know Lyme is an antibiotic, right? I mean, it's a bacterial infection, but medications do not treat. Medications numb and decreases. That's why people always have Lyme's again. So we need to work on the immune system, the soldiers, the army. We need to decrease inflammation, boosting, like decrease the stress. Lyme's disease, cancer. Every single humans diagnosed with cancer, whatever cancer you have, despite what your oncologists tell you need vitamin C. It's a lie. You see, the chemotherapy is not going to hurt you, right? But yeah, you're going to lose your hair. You're going to be weak. You can't eat. But vitamin C, no, we're not doing vitamin C because that's bad. The Warden Clinic has a great article on vitamin C. It is proven. I used to send patients to oh, what is that place in Mexico? Oh my God, no, it's not. Hope for Cancer. And then that's all they do with it. Vitamin C, ozone therapy, chelation therapy, all the services I do here, they do at Hope for Cancer in Mexico. And people were getting vitamin C every day. And they will leave that facility feeling amazing after 2 to 3 weeks of actively working on cancer. Please do your research. Do not take everything that the doctor tells you for like as gold. We're not God. I'm coming here to you, giving you this information because I know what this information can do for you and what this information has done for my patients. This is proven. I'm not new at this. Again, this is years. So vitamin C infusion is good for inflammation, any type of inflammation, okay? Autoimmune conditions, lupus, RA, multiple sclerosis, like you name it, Sjogren's disease, scleroderma. I use vitamin C. Hashimoto thyroiditis, vitamin C, my friend. I use it for aging and longevity. I am 40 something. I'm not gonna tell you. I'm almost, I'm almost leaving 40. But if you meet me, you think, oh my gosh, she looks 38. I use vitamin C for skin aging. And guess what? If you look at the skin products out there, there's always a vitamin C serum. So why we have vitamin C serum in the skin product? Because decreases inflammation, it helps with fine line and helps with collagen production. You look amazing. Because you have less inflammation, then your cells are able to rejuvenate and repair and restore easier and faster because it's less work they have to do. I love vitamin C. Infusion, okay? Infusion. All right, next question. How often should I get vitamin C? Again, depends on your case. For me, I'm doing maintenance. I do it once a month. If I'm traveling, 2 weeks before I get on the plane. All right. I'm about to go for a retreat in Virginia um, in May. I'm doing vitamin C leading up. Okay. I'm doing vitamin C because there's gonna be a room full of people. We're all gonna hug and sing and talk. It's gonna be a good time. I'm doing vitamin C. When I come back, I do vitamin C as well. I'm protecting myself and I'm protecting those that I'm faced with, right? Because I might have something I don't want the people with weak immune system to get from me. So I'm not only doing it for me, I'm doing it for my patients and my family. My mother does vitamin C. My family, Marilyn's family, Ty's family, we give them the gift of health through IV vitamin therapy. But it depends on your condition. So if you have autoimmune and we look at your inflammatory markers, right? Your practitioner can recommend. If you have cancer, and depends on the cancer and the stage of the cancer, then your practitioner can recommend. It depends. I always try to personalize and customize, individualize my plan for patients, but it really depends. So you have to talk to your doctor, do the testing, and then you can determine how many. But if you're like, okay, I don't have a doctor, I don't want to go through this, I would do vitamin C infusion every week, once a week. You not. And there's a misconception. Patients used to tell me, well, vitamin C causes kidney stones. That's a lie. No, calcium causes kidney stones. A lot of us are taking vitamins that have calcium in it, dangerous. Calcium leads to cancer. If you have any cancer, imaging report, there's always calcification. That means the calcium is leaking into your tissue and it's calcification. All dental issues is calcification. Joint issues, calcification. Atherosclerosis, plaque in your arteries, calcification. Please don't take calcium. Take vitamin C. Okay, you can see how much I love high dose vitamin C. I really do. All right, so how long does it take? Again, it depends on your vein, because in my clinic, we take our time. We're not just being rushed with you. I train my team to take their time. If you're hydrated, an hour. If you're not hydrated, which a lot of my patients are, they are not hydrated. Drinking water doesn't mean like you're gonna stay hydrated. They'll be like, well, Dr. Jency, I drink a lot of water, but the water's running through you. The water hasn't had an opportunity to stay inside of you to allow your cells to receive it. So that's why when you go to the hospital, they don't give you drinking water like this. They give you saline. That normal saline or that lactated ringer, there's something in the bag that makes the water heavy, and then that's hydration. So if you are hydrated, it's a breeze. But if you're not hydrated, oh my God, we go slow because again, safety first, and we want you to be comfortable, and there's no discomfort with my treatment. We don't do discomfort here. I don't like pain, and I'm afraid of needle. I'm needle phobic, but yet I've owned a vitamin therapy clinic successfully for 11 years, and my patients love it. So we always treat you the way I would want to treat me, with care, compassion, patience. Right. So next question, would I feel anything? Would I feel anything during the infusion? Nope, not my infusion. I know a lot of you are not exposed to vitamin therapy. You're like, oh my God, is it gonna burn? Am I gonna die? No. No. So that's why we take our time to find the vein. Okay, sometimes we might put some hot packs to create some vasodilations for the vein to come up to the surface. We do what we need to do for you to be comfortable. No. And then the day after, within 24 to 48 hours, we'll call you and check on you to make sure you're okay. And you have access to us on our HIPAA compliant portal to send any questions. We follow up with you. Is there any downtime after the infusion? Absolutely not. You can just, life happens. Go take care of your business, go to work, take care of your family. That absolutely not. I have patients that are like CEOs, they own businesses. They will come with a laptop. We have a private room here for them. They just have to let us know ahead of time. They're on a call, right? Or they're on Zoom meetings and they get in the high dose vitamin C. Nope. Can it help with cold and flu and allergy symptoms? Yes. Because what is cold and flu and allergies? Right? So the cold and the flu virus is activating your immune system, creating inflammation. Vitamin C does what? Strengthen your immune system, decrease inflammation. Allergens, all of the people that have major allergies out there, the allergens is activating your immune system. And vitamin C does what? Decrease immune system. So yes, you can literally help with cold and flu. Can vitamin C infusion support my skin health? Yes. That's the benefit that I'm seeing with vitamin C. Beautiful skin, collagen, reduce oxidative damage. And that's why all the hair skin gurus out there are putting vitamin C on every single product. Are there any side effects? Now, I cannot speak for other infusions. For me, in my clinic, with my patients, there are no side effects. Okay? But I have to tell you, since vitamin C is so powerful and vitamin C has a lot of hidden benefits, if you do not eat, your blood sugar can drop. That is to me, it's not side effects, but I guess to you side effects. So we usually tell our patients to blend a smoothie, eat before you come, because it's gonna literally act as a glucose, insulin, really, and then your blood sugar is gonna drop. I love vitamin C, really do. Everything you need you can get from vitamin C. Can I eat before and after the infusion? Absolutely. You can eat before, after. Actually, we do recommend it specifically with our high dose vitamin C. It's a big fat yes. Will this interfere with any medications I'm taking? No. No, 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 no. How will this interfere with any medications? A lot of us do multivitamins. And if you look at the supplemental table, there's vitamin C. That doesn't interfere with your medications. No, it does not. There's no medication interaction. That includes chemotherapy, infusions, or those breast cancer pills that people take, tamoxifen. No, it doesn't. Can it help with chronic fatigue? Yes, or low energy. Yes, 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 it does. By decreasing inflammation, allowing your cells to produce energy for you. Absolutely. It does help with chronic fatigue because chronic fatigue is a sign of something happening at the cellular level. Fatigue is not good. Fatigue is not good. The first thing people experience when they are getting sick is lack of energy, right? Because of the inflammation. Maybe there's a virus. Like if you have a cold, you're gonna feel lack of energy. If you have a cold, the flu is like, oh, I'm so tired. Your body's draining. Lack of energy because your body is conserving energy or your body is using it to fight for you. We need to do high dose vitamin C to support the cells. Can vitamin C help with detoxification? Yes, yes. I said yes, it's good. How much does a vitamin C infusion cost? Ooh, we're talking about prices now. This is a good question. So my high dose vitamin C is 294, again, preservative free. And doesn't matter how many needles I use or catheters I use, it doesn't matter. We just look at the person that's in front of us and we just do our best. Okay, but vitamin C infusion can range depending on the dosage and the clinic and the part of the state of the country you are in from 250 to 400. Yep. So I did a video and Marilyn and I talked about the vitamin C video because we have a special promotion running right now, right? And I did a screenshot showing how there's a place here in Cold Neck, New Jersey. Their vitamin C is 394. So it depends. So that's why every year, I always put the vitamin C on promo so people can buy, so you can save money and experience the benefits of it. But it depends on where you go. What is G6PD and why is testing required before high dose vitamin C? Oh man, this person is very smart. G6PD is enzymes that most doctors will check before they do high dose vitamin C. I used to do that at the beginning of when I was brand new baby of vitamin C. I don't anymore because I'm the expert and 90% or 95% of people will not have the G6PD, right? Because I am monitoring you and I'm looking at your basic blood test. We have you complete an intake form. So if there's anything, like when you're an expert, you don't have to have people pay money and go to the unnecessary. But I used to practice because I am certified IV vitamin therapy practitioner, like literally go and learn for 4 days in a hotel. So I had to follow the protocols and everything. But G6P is an enzyme that helps protect the red blood cells. So if you have it and you do high dose vitamin C, the red blood cells can die. You can have hemolysis, which is breakdown of the red blood cells, right? With high dose vitamin C. Again, I'm very good at pinpoint who has the G6PD or not by the fact that I've been doing this for 11 years. And to be honest with you, I have yet to encounter in my 11 years someone that has G6PD. So it is very safe. I know people just look at it at this, like, oh my God, I need to do this. No, you don't have to. If you work with a practitioner that knows what they're doing, you don't have to. Can vitamin C help with allergies? Okay, this is repeated. Yes, because a vitamin C can act as an antihistamine. So you don't need your Zyrtec, your Claritin, your Zysol, right? If you have high dose vitamin C. So high dose vitamin C acts as a natural histamine because allergy is histamine production, right? And anti-inflammatory and helps reduce the symptoms, seasonal and environmental allergies. How does it do that? By decreasing inflammation. Okay. And histamine production. Can it be combined with other IVs? Absolutely. Now, if you're doing high dose vitamin C, you cannot combine it with anything else because it's high dose. It's going to block the effect of the vitamin C. So I would do ozone therapy. I don't do high dose vitamin C because I use very potent and higher dosage in my practice. But when I do antiviral, like if I'm addressing a few viruses for patients, I put high dose vitamin C in it. If I'm doing an energizer IV, I put a little dose, like maybe 4 or 5 ml vitamin C, but these are not a high dose vitamin C. But you can combine it with B complex, L-arginine, taurine, zinc, selenium. If I'm doing a drip for hypothyroidism, I will put the selenium, L-arginine, taurine, zinc, and then I'll put the high dose vitamin C. Okay, but it depends on what we are treating. Does vitamin C support cancer patients? This is the work I started to do with vitamin C was cancer patients. It hurts my heart when patients are coming to me and they are interested. They go back to the oncologist and they were told this treatment is deadly. I'm telling you. And I just want to take all the oncologists and put them in a room and educate them. I'm like, it's vitamin C. Oh no, don't do vitamin C because it's going to interfere with chemotherapy. Vitamin C will not interfere with chemotherapy. You can do vitamin C without or with chemotherapy. When you do it when you receive chemotherapy, it's going to enhance the chemotherapy. And how does it do that? By decreased inflammation. So therefore, the terrible chemotherapy people are doing out there, my personal opinion, okay? I'm not judging because we all know the side effects of chemotherapy. You tell me how safe and effective a chemotherapy is, okay? Just go look, Google it. Dr. Google can tell you more information. Or look at a patient. Do you have someone that has cancer? Are they thriving? Anyways, but it can enhance chemotherapy. Vitamin C is beautiful for cancer patients. All my cancer patients, autoimmune patients, they all get vitamin C. My number one recommendation. How does vitamin C kill viruses or bacteria? Yes, it doesn't really kill the viruses, bacteria. What it does, it works on your immune system. The immune cells do the killing. Okay. It reduces viral replication and viral load. Okay, it prevents new viruses. It prevents new bacteria from taking over your body. And it lowers the oxidative stress during the infections. That's what it does. Can I take oral vitamin C alongside with IV vitamin therapy? Yeah, absolutely. Because remember, the oral vitamin C, you're not getting it. You're not absorbing it. It's not really going to your body. It's not happening. You're only getting 5 to 10%. So yes, you can take all the oral vitamin C you want. And by the way, if you're taking vitamin C probably once or twice a week, many of us are so deficient and depleted, you might need additional support every day. That's fine. How soon will I notice the difference? Again, it depends on your situation, the inflammation you have, the condition we are working on, your internal health, how your lifestyles, like it depends on a lot of things, right? So that's why we usually recommend to start with 4 to 6 and then we evaluate. If you do blood tests, for instance, we do a toxicity bundle here in my practice, people have mold. Like you don't see mold. You get mold from the food you eat. Coffee is moldy. Peanut is the worst nut on earth. We don't eat nuts, peanut. It's moldy. Grains are terrible, moldy. So when I do my toxicity bundle, I'm like, okay, mold, 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 mold. So I can recommend vitamin C for you. I gotta make this one because this can get very boring. Can it help with inflammation and autoimmune issues? Yes. How? Okay. Vitamin C has powerful anti-inflammatory effects and supports immune regulation and is very beneficial for all autoimmune condition. Whatever you have. Don't say, hey, Dr. Jency, I have MS. Can I have vitamins? Yes, you can. Lupus? Yes, you can. Yeah, RA, you can definitely Vitamin C. I have a patient here. She's probably watching this on Instagram. Her name is Imbecile. She came to me with two autoimmune conditions, both of them gone. She gave me a testimonial. She lost weight. Literally, her doctor was asking her what she was doing, and she gave the doctor my number. I'm like, so yes, we have to dismantle our belief. If whatever you're doing is not helping you, is not serving you, why doing it? Why not open your mind for new possibilities, opportunities? Why not be out there? We are afraid. We are afraid of trying things that has been in existence for decades. Okay? This is not new therapies. This has been like if you Google vitamin C history, you're gonna see this thing's been in existence, vitamin C infusion, since the 1930s. There's a lot of treatments we're surfacing right now, becoming more popular because patients like you, people like you and myself, consumers, we realize that the pills, the medications are not really serving us, right? So we want something better. So we go to Dr. Google and research. This is not new and it's not dangerous. Okay? Despite what the FDA says, but whatever. Can it support wound healing or recovery after surgery? Yes, absolutely. Yes. Yes, because of the collagen production, blood tissue formation, tissue repair, immune support, it accelerates healing. Yes, it can. All right, so we're getting close. How do I prepare for vitamin C infusion? You don't have to do anything. All you have to do is stay hydrated, eat something, and show up. That's my clinic, of course. So if you're gonna do high dose vitamin C somewhere else, make sure you ask them, is it preservative free? What is the dosage? What else you put in the bag? Do you couple that with something else? If they put a lot of stuff in the bag, it's not high dose vitamin C. Absolutely not. I have patients coming to me, oh yeah, I did a vitamin C drip. It has glutathione in it. I'm like, no, that's not high dose vitamin C. Oh yeah, I did it after ozone. No, no, absolutely not. Because high dose vitamin C is high dose, potent, cannot be done or coupled with anything else. You're not. So I don't know what other clinicians are doing out there, but please be careful. Ask all the questions. You educate yourself before you actually exchange that money or give them your hard-earned money. Are there any interaction with chemotherapy? Of course. I know this question was coming. The answer is no. So for my patients, my cancer patients or any patients, for them to feel safe, I will recommend because I know they can do high-dose vitamin C the same day, but again, what I know is not, they still have a little, skeptical. So I would tell them, why don't you just do the vitamin C on the days you don't have chemotherapy or do it once a week because I know chemotherapy is probably 3 days and then you get a break or whatever. So you can do it on the week or the days you don't have chemotherapy just for your peace of mind. Do I need that lab work before studying infusions? Okay, these questions are really good. So the answer is yes and no. No, if you're doing very low dose high dose vitamin C, very low dose vitamin C. For instance, if you see in a spa, you click on a lounge and they have the immune thing, and then you click on it, you purchase in, they're not requesting blood work. For me, if you're doing high dose vitamin C, I have you complete an intake form and submit blood work because I have to make sure that your kidneys are functioning. And how do you know your kidneys are functioning? Look at the comprehensive blood test, which is basic. It's covered by all insurance. All the doctors do it. That's one of the basic blood work that always come back positive, normal because it's basic. So we do a comprehensive blood work, right? So I have you submit that and I review intake forms for every single patient. That's why in my clinic, you need to complete the form 72 hours before you come here. If you don't complete your form 72 hours, we reschedule your visit. I don't care what you're getting. Because not only I want to make sure that what I'm infusing into your body is safe for you, but I want to get to know your case too. Right? Like, don't you want a doctor that's going to work behind the scenes before you come and get the services? That's me. Maybe because I'm like OCD and I love being safe. I don't know. But but you get the drift, right? Like you have to make sure you complete the form. So I look at the blood test. I have a patient right now who has beautiful story. Hopefully one day he'll be able to give me a testimonial. He's my success story. Maybe he's watching this. Can you please give me a video, a testimonial? Had a terrible infection. He was prescribed very powerful infusion medications to infusions, like IV medications, messed up his kidneys. He's only 30 something. Again, I don't have consent to tell his story. So I'm just going to give you the basic surface information. And then now he's on hemodialysis. He's been on hemodialysis for years. His heart, I mean, they put him on blood pressure medication. It's terrible what they're doing to this young man. Coming to us, he's not a candidate for high-dose vitamin C. Why? Because his kidneys will not be able to handle high-dose vitamin C. His GFR, which is the glomerular filtration rate, which is the filtration system, is under 10 when it's supposed to be 60 and up. Okay? We've been working together for a month and a half now, month and a half now. He's urinating. His hemodialysis decreased from 3 times to twice a week. I'm like, I'm gonna cry. I cannot make this up. Okay. And his pain on his own, his GFR went up to 49. That's how beautiful functional medicine is. And I am hoping, I'm praying the day that he gets to be 60 for us to do high-dose vitamin C. Beautiful. And because he's been seeing so many doctors, he has PTSD. I'm not gonna lie to you. So when I'm talking to him, like, people need to hear your story, is not ready to share with you all. But I'm like hoping and praying God that when he feels amazing, he's able to get here. I mean, talk to you or give me a Google review so you guys can see how, even if you're on hemodialysis and you feed your kidney cells, your body can rejuvenate, repair, and restore. There's no condition on this planet that cannot be reversed. I know I'm saying this, a lot of doctors will be watching this, they'll be like, oh, what are you telling these people? This is dangerous. How is that dangerous? When we know the medications, the side effects of the medications are adding to the cause, but yet we're pushing the medications. So this young man who came to me, hopeless, very paranoid, and like literally PTSD to the wazoo. Like I can ask him a question, he gets triggered. So I spent hours with this guy, and I have to it's like I'm walking on tiptoe because I'm like, I have to watch what I have to say. Doing beautiful. You might be saying, well, Dr. Jinsey, what are you doing with him? Well, I'm going to tell you what I'm doing with him. I am not your doctor. I'm not prescribing. Okay? Not. So we did the toxicity bundle, right? We discovered it has a lot of toxins. Okay? And the thing about the toxicity bundle, it tells you the toxins that you have, how you got the toxins, the disease associated with the toxins, the symptoms associated with toxins, and how and how to treat it. I love that test so much. It's with Vibrant, and it's 3 profiles that we check. So we did the toxicity bundle, but now what's really a game changer for him, we're using L-arginine in a drip. Like we only giving him 10 ml of fluid because again, he cannot. He's on water restriction. His kidneys are not working. So we're doing 10 ml. So we're doing a special drip, a special concussion for him. Again, I cannot say a lot because I'm not sure if he's watching or not, and I don't want to put his information out there. But if he's watching, he knows what I'm talking about. Because the L-arginine open up his blood vessels, causing vasodilation. So the food he's eating, the thing that we're doing together is infusing, going into his kidneys, and they are getting the nutrients to be able to revive. It is beautiful when I see stuff like that in my practice. We don't have miracles here, but it's like we have miracles here. When people come to us, they're like, okay, you are my last resort. We take that phrase very seriously. And I have to remind them, I'm like, okay, you're not broken, you're not on life support. It so happens you have not receive guidance or seen a doctor that's going to support you until the end of time or until you're ready, right? You have not partnered up with the doctor. And yes, you have to invest with yourself because you have to invest in yourself because we all know insurance covers 2 things, right? The medication and the cut, medication and surgery. And we had to go the conventional route. That's the first route we all take, the conventional route until we get frustrated. Like, okay, this is not working. I feel like crap. And then you might go to work functional. I've been there and I can relate. So with this man, I'm like, can't wait. I'm like praying and hoping and very impatient when his kidneys are like functioning at 59, 60. We don't have this vitamin C to continue decreasing inflammation, boosting his immune system, reducing oxidative stress, like inflammatory, all of the things, right? All right, so this is all the questions I have for you. If you are interested, not only in identifying the root causes of your symptoms, diseases, you can contact me. I would love, love, love to help you. If we don't do anything, right? But you want to know what is happening in your body because I tell patients so often that symptoms are a way of your body communicating with you. And 90% of people do not know the root causes of the symptoms. What is hormonal imbalance? Yeah, but which hormones is imbalance? Because you have a bleed, or you're bleeding for 2 weeks, or you haven't seen your bleed, that's hormonal imbalance? No, that's a blatant statement. Which hormones? I don't know. Okay, I'm losing my hair. Must be thyroid. Really? Can we look at your thyroid antibodies? Which one? I don't know. So you must work with a doctor and identify the root causes if you want to heal your body. If you do not know the root causes, I'm telling you, you might try all the quick fixes. You see this doctor, that doctor, show all of the things in the world. You might see improvement. You're gonna plateau. You're gonna go back to where you started. So the first step to healing your body is to identify the root causes. So if you're interested, you can reach out to me. We can work together. I do telemedicine, virtual. I'm here in New Jersey. If you live closer, come in. We'd love to see you. But IV vitamin therapy happens to be one of the secret sauces. It's no longer a secret because I talk about it all of the day, all of the time. But there's nothing better than taking care of your cells without clogging your gut. Right? Like all the pills people take. Today is Wednesday. I saw a patient yesterday, and that patient was taking 10 different supplements. To me, it's a no-no. 10. I'm like, wow, that's breakfast, lunch, and dinner right there. Please don't do that. Supplements, replacing your medication with supplements is not going to promote healing. So, anyways, I'm done. All right, so that's it. If you guys want me to do more live like this and come and talk to you about different things we see in our clinic, how, I can help you or different conditions, whether it's hormonal imbalance, because I'm doing a lot of hormonal imbalance work now, or weight loss. I do weight loss completely differently. Okay, we identify the root causes, or gut issues, hair issues, thyroid issues, autoimmune conditions. We can talk about it. Let me know, and I can dedicate an hour or two on Wednesdays, and we can do this. Because I used to do this a lot, but I don't know if people were interested, so I stopped doing it. But if you're interested, I would love, love, love to go back and doing that. That's my way of educating you so you can take that information back to your doctor and ask the right question. Because doctors, when they look at you, they're like, oh, you know things. They're gonna treat you differently. But if you come, you're like, I'm at your mercy. Do whatever you want with me. We don't want to have that energy, right? We want to be educated and empowered and hire a doctor to partner up with you on your healing journey. But first, you have to dedicate a few minutes in learning about your condition. And I would love to go on this journey with you. If you are in New Jersey and New York and you're interested in driving, because I have patients coming from Maryland and Virginia here in New York to our clinic, we'd love to have you. We'll give you the best IV vitamin therapy infusion of your life. We always customize, individualize our drip. You'll feel the difference, but we'll take great care of you. Until then, I'll see you on the next Facebook Live, Instagram Live, or YouTube video. Yay. All right, so I gotta stop this YouTube because I'm recording. I'm so not good at this. Actually, I'm